So we are at the top of the hour. So in respect to everybody's time and schedules, let's get started. And welcome to our last study group meeting of this fall 2024 series. I hope you are getting ready for the exam. You feel more confident. You joined your peer groups to study together and motivate each other, which is always a great thing to do. We feel somehow more responsible when we are left just on our own. We say, yeah, I don't have time. I will do it next time, or I will do it tomorrow. And tomorrow something next comes, and it's always tomorrow. And it's the chasing of tomorrows. But as I said before, when we were here just with Sudha and Diana, if you feel nervous, that's normal. Just don't get anyhow pushed off balance. Feeling a bit, unease, that's absolutely normal. But don't let any kind of panic to try to rule you, especially during the exam. Like, I don't have time. My answers are definitely wrong. I need to go back. I need this. And then I feel like I'm thirsty. I need to go to the bathroom and I missed that. So all these kinds of thoughts, these are just distracting. They are very natural. We all have the same thing. We always, no matter how many exams we passed in our life, feel some kind of slight anxiety, and transform the anxiety into excitement. Rephrase it. Say, I'm just excited. I can't wait to go through, and I'm going to do great, and I'm going to make it. So think about it, like try to see it you already achieved, not to get overconfident. That's not the point. But somehow to transform your feelings from more resembling fears to more resembling expectation, say, an expectation of good things. So let me just push a couple of slides, and I really want to give you space for questions. So this is your meeting, your study group, your preparation. We are here to help you. So we do not need to go through all the questions from the practice exam, because you can take it on your own. You can see the answers and everything. It's free of charge. There is no paywall. So let's just take a look at a couple of things and then open it to our conversations, and anything you would like to ask about, or anything that you would like to share, maybe a good experience from your preparation. Okay, just slightly up. So now I don't see anyone raising hand because my toolbar is obscured by the grip of the external camera. So if you want to say something, just unmute and jump. I don't mind, no problem. If you want to raise your hand, Klaus and Pam will help me. They will tell me, okay, here is a question, or we need to pause. So we are organized, and let's get started. We reach the last one, which is assessment, analyzing, and evaluating. Few tips, as we always shared and always repeated at each meeting for the exam writing. 165 multiple choice questions. 15 of them are being tested, but nobody knows. I mean, I don't know, you don't know, Pam does not know, only the evaluators know which questions are the test ones that they want to see if they are causing problems, and if there are any particular difficulties. They might be new questions, but they might be scattered most likely throughout. So not the first, not the last 15. Don't count on it like that. 3.5 hours, meaning you have less than 2 minutes per question. For some questions, plenty of time. For some questions, that's a little bit tight. So where you save, the question is easy, then you have this additional time for some more challenging questions. If you are not a native English speaker, consider it's still time. It's still time to reach out to SQA and say, I want to buy additional time, 1 hour at a test center or 2 hours if you do it online. It gives you more ease and more comfort if you need more time to think about the questions or you don't recall a word, then try to figure out what it may mean. So it's really recommended. The practice exam I mentioned. There are 3 main regulations that are covered, and that's FDA 21 CFR, although this is a huge topic itself. ICH E6, the current version, not the upcoming. So it's the E6R2, the one that was released 2016. And 21 CFR Part 11 for computerized system electronic signatures. This is a very short, I always recommend reading it because it's very useful. We have so many systems. So for our practical life, it's very useful to know this. It's something like 13 pages, nothing discouraging. Excuse me. So I guess you've already read the regulations, GCP, and you are quite familiar. No question is about which paragraph or which chapter, but always to understand what the regulation aims at. Meaning, it's a good thing to read the preambles, because the preambles, they tell us what is in scope of the regulation, what is out of the scope, what is the purpose of the regulation, why anyone bothered to write it and release it. Read the candidate handbooks, recommended materials, and answer questions taking really your conservative hat. May be different from what you do in your organization. Go again through your peers' advice and tips, but if you see it differently, if this is not what you do or what you feel comfortable about, there is absolutely nothing wrong. Each person is different. So reading the questions very carefully, especially not skipping small words like not, what is not the best choice, or what somebody should not be doing. The same goes for the answers. Watch your time. And most of the time, if you are not sure, you can straightforwardly exclude 2 of the 4 options. And then you are left with 2, and just guessing means I have 50% of chance, 50% of failure. It's like flipping a coin, like randomization in typical randomized clinical trials. But okay, better to guess than to give no answer, because you still have a chance to have it correct. Watching for keywords. Applying logic and common sense. Try to imagine what I would do, what would be my approach in this situation. Is any of these answers really in line with my thinking? Because our first guess, our gut feelings, most of the time drive us the correct way. I know from my own tests or quizzes I do just for fun many times. Yes, my first answer is correct, then I go back and second guess, and I have it wrong. So that's very often, that's very common. So don't try to re-examine yourself. And what is analyzing and evaluating in this context of our practice exam and the real exam? Analyzing is the methodological examination of information. So I have some information. Information comes from data. We put it this way. I collect data, and when I somehow organize and structure the data to start making sense, I get information. I'm not collecting information, I'm collecting data. When I process the data and come to information, then I analyze the information to see explanations, interpretations. And finally, the evaluation, or we may say assessment, is the same thing. There's the critical assessment of the authenticity, integrity, compliance level, significance, adequacy, and quality of a process, system, or physical entity. I took this from the handbook. This is not my definition or something I Googled or ChatGPT advised. So You may be defining it differently, but the meaning would be approximately the same. What we are analyzing and evaluating in our job. Compliance, like study protocol, procedural documents, GCP, applicable regulations, vendor qualifications and suitability, adequacy of audit resources to complete contractual obligations. This is what I'm struggling right now. I'm preparing for an audit. I see very strict, I would say almost unrealistic requirements in the contract and what is imposed on the vendor. And I see they departed because simply they could not find people fulfilling all the criteria. Now, is it a finding against the sponsor for unrealistic expectations and wishful thinking, or is it a finding against the auditee since they were not able to find suitable people despite having resourcing agencies, or both? Both have their part, and this here sometimes come the logic. I may have these requirements and I would find plenty of candidates in the United States or Europe. But maybe in Asia Pacific, it's a different situation. Should I relax the requirements? Also, the requirements should be somehow adjusted to the environment. So it's not having the same set, which is inflexible and unchangeable, and then I try to apply it anywhere. That does not work either, and will just result in deviations, departures from the intended purpose, and so on. Adequacy of remediation activities, completeness, accuracy, reliability, validity, study data. We can say altogether quality of study data. Integrity is something different. Integrity means that when I move electronic data from one place to another and to another, it remains the same, including audit trail, including metadata. It does not change during migration, transmission, and so on. But integrity, from this perspective, does not tell me if it's accurate. So I was always thinking of saying quality and integrity. Are we just duplicating the same thing? And then after some discussions with colleagues at the DIA and SQA, we realized, no, it's not exactly the same thing. Both need to be there. We analyze informed consent process, participants' privacy and protection, and whether they are truly protected in a study. We evaluate whether all the requirements been met. Physical and logical security procedures, trends like audit observations, deviations, CAPAs, effectiveness of CAPAs. Do we see, are we getting better? Are we the same? Are we getting worse? This is the trend always over time. I need at least half a year to be able to see any kind of trend, and maybe a year if the process is not repeated every, say, 3 months or a couple of weeks. So the frequency of the process over time helps me to define how much time I need to evaluate a trend. Quality and compliance risks. Interview responses. Are they lying straight to my face? Are the answers logical? Does it seem like something memorized, but not necessarily what they do? So how do we analyze? We need to keep in mind regulations, company policies, SOPs, quality manual, guidelines, if the organization declares to know them. ISO standards, if applicable. So these are the things we can cite against when we audit. But if, for example, an organization is not certified for any ISO standard, I cannot cite their quality management system against the ISO standard 9001, but against their SOPs, because there I should find how they are planning and building and executing their quality management system. The same with guidelines. This is the current thinking. They are highly recommended to be followed, but the organization has the free hand to define what really specifies the applicability depending on their structure, what they do, business models, and so on and so forth. But regulations, company policies, and SOPs, these should be followed. So these are always the safe parts that we can, if we can tag any finding against regulation or company policies and SOPs, then that's the right way to do it. How do we analyze? There are many different analyses. Gap analysis, Ishikawa diagram, root cause analysis, 5 whys. By the way, it does not mean I stop at my 5th question. If I see it's going further, and the 6th question would really lead me somewhere, I'm not going to refrain myself from asking the 6th one. So take it as a kind of approximation. Failure modes and effects analysis, trend, which we just mentioned, Pareto, and combination of all the above, which is the most useful. Use because I can combine one with the other, and just the combination would really help me to get good results. And how to evaluate? We already mentioned the participant safety, well-being, confidentiality, data quality, integrity, reliability of outcomes and conclusions of any study or process, interpretation of data, and so on, fulfillment of contractual obligations, effectiveness of CAPA implementation, regulatory compliance, adherence to own company processes and procedures, information security, cybersecurity, and so on. So these are the aspects we should keep in mind when we do a holistic evaluation. What applies? And if we talk about study, we have a combination of many of these, if not all of them. So it's not isolated. Let's always try to see things in the context, in the environment, more holistically, not just the one tree, and I'm ignoring the whole forest. But let's look and map the processes and look at the whole thing, maybe from the bird's eye view, maybe more from a distance, to get different perspectives and really understand. And our goal is always to have safe and effective medicinal products for consumers. Decisions driven by ethics, critical thinking, and verifiable data. Do we have, excuse me, any questions, comments, or anything you would like to jump to start a discussion right now before we take a look at any questions from the practice exam?
I don't have a particular question. I know that I've taken it before. And I think, as far as like taking the exam and answering the questions, I've been doing pretty okay. But I think I don't know where I'm getting crossed up. I looked at my report. I'm kind of like a few points off from like meeting the demand. So I'm trying to figure out how I can push over the edge this time.
I'm not sure I really understand the question. And the line was breaking a little bit for me. So would you be so kind and just say it again?
I was just saying I've taken the practice exams and did well on those, as well as got to the test. I think more is the timing. I'm just trying to figure out what are some strategies that I can kind of actually pass the test. I think I've taken it a couple times and I'm like so close to passing, but I don't meet the mark. I'm trying to figure out what I can do to cross over, if that makes sense.
Okay, so one thing, the practice exam is outdated. So you may find it very easy and you think, as I did, if the whole exam is so easy as the practice exam, nothing to worry about. Well, it just gives more the flavor of the timing, because I have the timer, so I need to adhere to the time. And the kind of logic of the question and answers. But I would never try to extrapolate thinking, okay, this is going to be like a little bit bigger practice exam because it's not the case. And I've heard many people saying that was way different and a very different experience. And they were a kind of anxious when they find out seeing, okay, the real exam, that's far more challenging. It's not like the practice exam. So take it with some, I would say, rather bigger reservations, the practice exam. And, you know, here we have, in the practice exam, we have 30 questions. So that's pretty easy. You answer 30 questions quite straightforwardly. Having 165 questions, 5 times more, that's a different thing. So just the time itself for the real exam it's a different feeling. For me, like sitting for 3 hours, that's a torture. I need to stretch, I need to get up, I don't feel comfortable. And many people who might be suffering from back pain or any kind of, let's say, physical challenge, and you don't have to be really anyhow disabled. It can be just because your muscles are tired after some time. So that can increase the feeling of discomfort, that increases maybe the urge to try to rush through it, which is not a good idea, because if I try to rush, it's likely I'm going to overlook something. So I would like, like try maybe, you cannot take it the practice exam 5 times in a row and it would be the same thing. So that would not really help. But practicing with your peers, like, okay, now let's, for 1 hour, let's keep asking questions and giving answers. And it doesn't matter how we ask them, what kind of questions. It can be from just any area. Just have the feel. I need to keep going on, and I need to keep focusing instead of my decrease of attention over time starts taking over, and I'm totally fine for the first half an hour, and then I'm starting getting tired. I don't know if this answers your question. Maybe Pam, Klaus, you can add something from your perspective.
Yes, definitely. And I laugh about being uncomfortable. I took my test during COVID. So I was, with a mask on doing it for the 3 hours. But anyway, I think one thing that really helped me was because it's I took it electronically. And if I didn't know an answer rather quickly, I just skipped over that. And with the electronic system, is you can always go back to those that are not answered. And I found that, maybe later on in the test, another question would, knock that brain cell a little bit and give me a clue or, wake up my brain a little bit to say, oh, that's what they were asking, or yeah, that answers the question, or may help me to answer the question. So that was one of the things that I really found very helpful for doing that, is something you can answer rather quickly. Go ahead and answer it. If you find that you're struggling with that question, go on. And you can always come back to it if you have enough time. But once again, watching your time. Someone has a question: is the exam in paper format at the testing sites? The testing site that I went to, it was electronic. So I think you would just have to see, I think most of those are electronic now, if you go to one of the certified testing centers. So that was, I have to admit, well, it was one thing that helped me, but also the practice exam on how the questions are asked. So if they're asking for, watching for words like the best, the first, which of the, pick all that apply. And that way you can go through and usually there's 1 to 2 answers that are not correct. or they're not nonsensical, but certainly would not make sense. And so get rid of those immediately. And as Camilla said, it may be a 50-50 at that point, but that would give you a little bit better chance to go ahead and pick the correct answer.
And I think, Pam, you basically also mentioned that as soon as you feel you cannot answer a question, I would really skip it because it really holds you up. So first of all, really get confident and walk through all the questions where you immediately know the answer, and then really go back to anything open and spend more time on those.
Yeah, I know some people may have different strategies and they really don't like to skip anything. If you are that kind of person, then okay. But for me, I would also skip it and then come back. That would be the most reasonable thing. It's better if I maybe don't have time and don't answer 5 questions that were difficult for me, than spending time and then not having time to answer 20 questions. That would be a very different outcome.
Can I ask a question? The section on the exam called Applied Expertise, Communicating, Educating, and Reporting. Do you have any advice on the best way to approach those questions?
Pam, do you remember if it's somehow separated at the test? I don't think so. I
don't think so, no. I think it's just those are the different
categories. Yeah,
categories, kind of like we've broken up the 6 different categories, the 6 different study groups that we've had is those sections on the actual job that you would be doing and how the test is distributed. Those questions are distributed within those different areas.
I see. Okay. All right. Thank you.
And unfortunately, you don't know what the new questions are. So those are all intermixed in there. So you have no idea which questions are those also.
Okay.
I would not try to somehow tag it. Is this about evaluating? Is this about advising? No. It makes very little sense to me to do it this way. Just focus on the question and the answer options.
Yeah.
I mean, if there's something you know nothing about, I have never worked in devices. They can ask questions on devices. So I looked at, CFR, what is it? Is it 812? I think it is. Just read over those, and where I found is what is the difference between drug and device. And so if they have something, it's like, oh, they don't sign a 1572, they sign an investigator agreement. Those type of things. And that way I knew there was a difference there. But all the other things that are the same, I didn't really study those per se. It was finding the differences on an area that I knew nothing about. And I still know nothing on that. So we had a question again. The flag feature still works in the new exam. How do we know which ones we've skipped? From an electronic point of view, it comes up and it has that you can go back to those that you skipped that were not answered. You can go back to any of the questions. Also during the exam, you can't take any paper in with you, but they will hand you a pencil and a blank piece of paper. So you can also write down those questions, the number and maybe the topic, if you want to, of those that you skipped. You can't take that with you when you finish. They take all that back, but you can have like a scratch piece of paper. I've also seen, not for this test, but other testing, they almost give you like a whiteboard too, that you could just jot down notes if you wanted to. And sometimes that's helpful to say, oh, the question was on investigator responsibilities. And let me just put investigator responsibilities and go on to the next one. So if I come across another question, I'm like, oh, okay, I can go back to this one. So it was very easy to do that. And I seem to remember too that they also had like a little clock on the screen that showed you how much time either had already passed or how much time you had left. So you'd easily be able to look at that also. I hope that answered your question, Diana, sorry. Any other questions before we discuss some of the practice exam questions? And just a little tidbit of information. Because the practice exam questions are kind of old, a lot of times they cannot utilize the actual questions as part of the practice exam, obviously, because that would expose you to the questions. So a lot of times if something's been archived off of the test, that's sometimes something that they will utilize for practice exam questions also.
Do we have any more questions at this moment?
Doesn't look like nothing in the chat.
Okay, so let's just take here a few examples from the practice exam. During an audit at a clinical trial site for a blinded study, the auditor determines that the sponsor sent open unblinding envelopes to the site. The envelopes were maintained in the site regulatory binder. What observations should be written in the auditor's report, if any? Select one. You always have select one or select all that apply. This will indicate whether you need to choose just one answer or you can choose more. But if more, it does not tell you how many. So you would be able to tick more, while if you have select one and it's electronic, if you choose another answer, the first one gets unticked, so to say. The envelopes permit undetectable breaks in the study blind at the site. The envelopes were not sealed by the investigator after a proper review and inventory at the site. The envelopes were not maintained by the blinded investigator in a secure location. And last option, there is no observation. So what do we have in the chat? 1, 2, 3, or 4?
It's mostly 1.
1, and anything else than 1?
1, 3.
Okay.
2 3s.
2, 3.
Let's give it just a few more moments. And let's now, Klaus, Pam, what would be your choice?
I mean, I
Well, I
would
think-
choose 1.
Yeah, I think the most important thing, observation, would be the envelopes permit undetectable breaks in the study blind at the site. So someone could pick up the envelope, obviously if they're open, look at it, and you would never know. And for those of you that are much newer, this used to be what happens. You had, if you had 50 patients at a site, they would send 50 envelopes, sealed envelopes that you could not see through, and they would have the randomization treatment code on the envelope. If the envelope needed to be opened, there was a huge process for that. It had to be signed and countersigned and what time and date and things were done. And then it should be resealed so no one else sees it. So unfortunately, this is a little bit dated as far as utilizing envelopes. So apologize for that.
So actually, Pam,
I still saw it, and that's not such a long time ago, and I was genuinely shocked because I thought this was already, way in the history, and nobody is using that anymore.
Yeah.
But still, we may be
sorry, I think there was a comment. Diana was speaking up.
Oh, thanks, Pam. Yeah, I just wondered what scenario, because this does seem like a dated question. But so what scenario do you think would this sound like in today's world with so many electronic documents where something could be undetected, or like, I don't know, I guess I'm looking for how could we reword this question so it's more current?
I think I think it would be something like IRT, somebody the IRT system malfunctioned, and actually, instead of printing out the kit code, they printed out the treatment code, and it was put into the file.
Mhm.
So that I have not seen that, but something like that could happen, and then you never know who actually saw the treatment, or the pharmacist accidentally put the form in there, and so they're in the ISF at the site. The pharmacist put the treatment code in there, so that would be undetectable unblinding of who.
Mhm.
You don't have any idea.
Or simply incorrectly assigned privileges in the IRT. And then typically the unblinding is a kind of responsibility of the principal investigator, maybe one deputy. But if anybody gets the privilege to unblind, that can be a big problem.
Yeah, so, and also looking at like number 2, the envelopes were not sealed by the investigator. Well, you wouldn't want the investigator to review anything as far as unblinding envelopes. So obviously that would not be a good choice. There were a couple of answers to number 3. The envelopes were not maintained by the blinded investigator in a secure location. Yes, that would be if they were actually sealed. The problem is the unsealed envelopes were sent. Not that they weren't stored in the right place. It was the sending of the unblinded, unsealed, unblinded envelopes. And there was no observation. I don't think that's a good choice. If they say if there's an observation, there should be a darn good reason if there's not an observation. Additional information probably would have been provided.
I just remembered one thing. I remember not recently, but years ago, when unblinding envelopes were more frequent. Maybe you remember from the past, maybe you've had that experience, or you've seen your parents when they were getting some codes from the bank. For example, now if you want your PIN code, then you just go maybe to ATM, you select the card, then it gives you the possibility to change somehow to authenticate yourself and to change the PIN code to the desired one.
Mhm.
But in the more ancient times, you received your new card and you received the PIN code or a letter with a ciphered way how to find out, meaning there were string of letters, and you get also the key how to find out what is the PIN code. And these were always set separately, never together. And they were in a kind of envelopes that had an inner layer, which was with some patterns. So even if you put it against a window or a light source, you cannot see through. In normal envelopes, the typical ones we use to use for letters or postcards, you can see through at least something. But these you cannot. And I remember that the envelopes were actually transparent envelopes, like normal envelopes, like any other envelope you would go to a stationery and buy it there. So these were not the envelopes that were preventing to see through. And it was possible to see the codes, at least good part of it. I mean, big enough with some additional information. And, even in double-blind studies, the investigators, many times they have pretty accurate guess which patient is taking what, because they may see some typical side effects, perhaps of a class of drug. They know their patients, they have experience. So I know that in reality, they are putting their guesses and then they are waiting for the unblinding, or they used to wait for the unblinding to see how accurate was I this time. So if you have this experienced investigator and they see part of the code, that's as good as unblinding, because that confirms what they already think they know and just gives them the answer. And sometimes, by the way, you may have allocated drug codes, and the allocation, the randomization list is not created properly. So you can guess what the next patient is going to get. It's quite easy to break the blind if there are patterns. I once attended a webinar. It was more from the statistician's perspective, and they were giving examples. And I realized, yeah, I can guess the next, what is going to be the next. It's not that difficult once you realize what you should be looking at. Everything now is machine generated. It's really difficult to guess. The chance may be 1 to, I don't know, 30 million or something like that. So if the systems are working properly, our blinding is quite secure. But if the systems, and then we go back to 21 CFR Part 11, is not working properly, and it's not reliable, and it's not duly validated, then anything can happen. And the electronic system may produce something which is, well, completely flawed. Let's move forward. Pam, would you take this one?
Certainly. Ongoing non-compliance was discovered participants not meeting protocol required study visit windows. We see this quite often. The primary root cause was identified as appointments rescheduled by untrained office staff. 3 of the following remediation activities were implemented by the site. Evaluate which was adequate. So this is one of the questions, obviously, if you can see by the answers, that you can have, you need more than one answer. So it looks like 3 of the answers will be utilized. So going through each one of those, number 1, discuss the importance of study visit compliance during the consent process with candidates and throughout the study with participants. Office staff was formally trained to transfer participants' calls to a designated study team member for all study-related inquiries. 3, participants were informed of the requirements to notify staff of any visit cancellation at least 24 hours prior, and participants were flagged in the appointment system to prevent rescheduling by office staff. So going back to a clue, the primary root cause was identified as appointments rescheduled by untrained office staff. So that's their root cause analysis, going back to, could be the 5 whys, how it was analyzed. So thinking about that, going into the answers, obviously 1, 2, and 3, 1, 3, and 4, 2, 3, and 4, and 1, 2, and 4. So answers in the chat, please.
Mhm.
Looks like we have mostly 4s and 1 number 3.
Any more answers coming?
Yep, there's another one for number 3. And we're not getting any additional answers.
Okay, so Pam, Klaus, what would you choose?
I mean, I think definitely 4, because as Pam mentioned, I think it's really about untrained office staff, right? So I think that's why you might want to exclude response number 3. But it's basically, in general, I would say it's all really good for preventative actions, right?
Pam, anything to add?
No, and I think that, yeah, number 3 kind of goes back to the participant, whereas the rest of those really put it more on the office staff or the clinical staff. So I would pick number 4, 1, 2, and 4.
Can I ask a question about that? So
Of course.
I got this wrong on the practice exam, and I'm wondering now when I look at it, it's so funny because if you look at it, all of a sudden different ideas come to mind. On number 3, where it says participants were informed of the requirement to notify staff of any visit cancellation, nothing in the question tells us that the site had a requirement. So when I'm looking at this, should I say to myself, well, the question doesn't tell me that there was a requirement to notify the staff. You know what I mean? Like, would I automatically deduct that one, take that one off the board because I haven't been told that there was a requirement? Do you know what I'm saying?
Yeah, I don't think that's not the way I would approach it.
Okay.
I'm
Okay.
saying is because they've been rescheduled by untrained office staff.
Right. I think 1 and 2 are a
Obviously they're
given.
out of windows. And even if the participant could be informed to notify the staff, that's not going to change being outside windows, because if they're rescheduled, then they may still be out of a window.
Mhm, mhm.
Okay.
So
Okay.
All
right.
I think the onus here was the untrained office staff.
Right.
And
right.
the participant wouldn't have anything to do with that.
Right. So if I look at this and I say, okay, I know 1 is going to be in the answer, so it's either going to be 1, 2, or 4, or I know 1 is important. I'm sorry. I know 2 is important because you were talking about untrained staff. So the answer is going to have 2 in it. So now I've got either 1, 3, or 4. And then, I mean, like I like process of elimination, almost like going through it that way and trying to figure it out by process of elimination.
Yeah.
But
No.
I think I struggled between 3 and 4. I thought 1 and 2 were definitely givens. And then I was like, I don't know if it would be 3 or 4. And I kept kind of, vacillating back and forth between the 2 of them. And I ended up getting it wrong. But again, now that I'm rereading it, I hear what you're saying, that don't put the onus back on the participant. This was a site audit, this was a site issue. So put the onus back on the site to have some sort of preventive action.
There is
I'm trying to think of how I should make my brain think about it when I'm answering the question.
And you also say 3 of the following remediation activities were implemented. So number 4 fits that one a little bit better.
Yes.
Participants flagged in the appointment system. You've been to sites and they're like, okay, this is a clinical patient. We, have to follow the windows and things.
Right,
so
right.
At 3 and 4, that would make 4 more adequate to show what the remediation activity was.
Exactly. Okay. All right. Thank you. I appreciate that.
Sure.
It's almost like
It's a close one.
Yeah, it's like talking through it sort of, helps you sort of figure out, how to eliminate the wrong ones, so to speak. But thank you.
Yeah, and
I would take one more perspective regarding the number 3. Participants were informed of the requirement. Well, even if there were such a requirement, is the requirement realistic? Think about normal life. The participant starts feeling unwell a couple of hours before the visit and just cancels because falls sick, or there might be some weather event, or let's say really torrential rain or a strike of the transportation, and the participant simply can't get there. So is it unrealistic to mandate is it feasible to mandate the participants to notify the staff 24 hours prior? No, it's a wishful thinking that I would like to see maybe, but in real life, I can find dozens of examples where still the visit would be cancelled, but it could be just a few moments. So you can find a good number of reasons against 3. Klaus, can you continue, please?
Of course. So the next is again site audit related. The storage requirements for an investigational product are documented in the protocol as room temperature, so 15 to 25 degrees Celsius. Which of the following observations would be reportable audit findings? Select one, so 1 out of 4. A computerized temperature monitoring system was used to monitor the temperature daily, but was not reviewed until the end of the study. The second option, a temperature log was used to document daily checks with temperatures ranging from 18 to 23 degrees Celsius. Number 3 is a minimum maximum temperature device was used to monitor temperatures. And number 4 is the person documented the initials and date with the temperature reading daily. So 4 options. Which one would be considered an observation in an audit? And I see a lot of ones coming through. Very good.
I think it's quite obvious, this
Yeah.
one.
Yeah, I have a query in this actually. So I've done the sample test, so I could answer it as one after many attempts. But if you see the second one, there was a log which ranges from 18 to 23. They didn't allow them to document the extremities, like if it goes out of 15 or if 15. So I thought initially that would be the finding, like on why the log is designed with 18 to 23 degrees Celsius.
Mhm.
Why can't be the two? Yeah.
Yeah, but you see, it's narrower than the allowed temperature range,
Yeah.
but it's within that range. So if I put it more strict, okay, I make my life more difficult. Then is a question: if it's 17 or 24, should I have any kind of action? But I'm within this range. If the range that I put in the form is, let's say, 20 to 30, then it's a different story.
Mhm.
Do we have anything different than one?
No,
No.
everybody has one.
And everybody's right.
Yeah.
The big problem is that it was not reviewed until the end of the study. So how on earth to know the IP is fit for purpose and that storage conditions haven't been compromised? You have no idea. And that's a real problem.
Yeah.
What
This-
is
I
now,
mean-
I go back and I see, okay, I had a huge excursion here and it was lasting for 1 week because there was a heat wave. What then? Nothing, because it's way in the past. Pam, you wanted to say something?
No, I was thinking that, looking at this too, if the first one is like, oh, they have a computerized temperature monitoring system, you might go, yeah, that's a good thing. But read the whole question or the whole answer, and not reviewed until the end of the study. And the other ones are within requirements of the temperature log, daily checks, the little bit tighter temperature, min-max temperature device was used, which is good. Person documenting initials and daily, reading logs that way. And then you're like, wait a minute. If they're all good, then there's still one that's wrong. So which one would be an observation? So that would be another way to look at that, but read the whole question, or, the whole question and the whole answer.
Yeah, not just the first line. That would be definitely not be enough.
Yeah.
And don't look at the longest answer or the shortest answer, because believe me, I used to work on another organization's questions, and we would add words to make sure they were all kind of the same size. So
Good
not-
point. Yeah, sometimes we tend to think that the longest answer must be the correct one.
Yep.
But that's not necessarily right.
Okay.
Okay,
Jimmy, did you?
Go ahead.
Okay, site audit. During a sponsor audit, an auditor finds original, fully executed, informed consent forms from an ongoing trial in an unlocked file cabinet in the hallway. What is the auditor's observation? And once again, select one. The original signed informed consent form should be maintained at the CRO. FDA regulations require all study records to be stored in fireproof file cabinets. The original signed informed consent form should be maintained at the investigator institution location. And 4, FDA regulations require all study records to be stored in locked file cabinets.
I guess everybody answers immediately and correctly because this is so obvious.
Yeah.
Because it's sponsor audit.
Thanks, Bryce. I like that. So this one's a little bit, I mean, you kind of have to look at the question. It says during a sponsor audit. So thinking of where you are doing the sponsor audit, finding fully executed informed consent forms. This one threw me for actually when I first read it, because I passed right over the sponsor audit part of it. So number 3 didn't make as much sense to me at first. And once again, I read it just too fast. So looks like most people have 3. Obviously, the original signed informed consent form should be maintained at the investigator institution location. They should not be at the CRO. They should not be at the sponsor. They need to be kept, the original signs, at the investigator site. So obviously that negates number 1. It's kind of interesting. Number 2 and 4 almost supersede each other, or are almost subservient to each other.
Complement each other?
No, because if study records stored in fireproof file cabinets and then study records stored in locked file cabinets,
I may have file which is not locked.
True, or you may have a file cabinet that's not fireproof. So I've seen that too.
Exactly. So they complement, in a way, they complement
each other. Yeah. So,
but, where
I don't know.
Should be the copy? The copy should be with a participant. And I've seen copies at a CRO. I've seen copies at a sponsor. I've seen copies uploaded somewhere. Believe it or not.
Copies, yes, that I have seen, but the original signs should always be at the investigator site. But
so can I jump in there for a second?
Sure.
Of course.
Well, the topic says site audit. So it gives the impression the sponsor audit is happening at the site.
That was my title. Sorry, I probably made a mistake. So please, apologies for that. But no, it's just really the wording of the question and the answers.
Okay, and this one I totally got wrong in the practice exam because I'm so used to being at the CRO where everything's locked in file cabinets. So this, I'm really glad you covered it, but now I understand much better. Thank you.
But then thinking also, an original fully executed informed consent form has the trial participant's full name. So they should not be anywhere else than at the site. So if you have seen them in a CRO, that's not the place they should be, or a TMF or things like that. So that it's not exactly the cabinets that's the issue. It's
the personal information.
It's the form itself, the fully executed original.
Yeah, exactly. It's basically, it's problem maintaining the confidentiality.
Yes,
that is violated.
It's data privacy.
Yeah.
So it doesn't matter if somewhere else at a sponsor or any other place is a copy or a scan copy or whatever, still has no place there. And it should never be in the TMF. It should never go outside the site, and the copy should be with the participant. That's the only 2 proper locations for a fully executed informed consent.
Yeah, once again, you're reading into the question. I think the file cabinet was just a distractor.
Distraction, yeah.
Yeah,
Exactly.
I got this wrong on the test as well, and then went back and and said, gosh, what did I get wrong? And then I started to reread it and I went, oh, sponsor audit. So it almost made me realize that, I've got to take my time and really read the question and
I did
not
the same thing.
fly through it, not fly through it. Yeah.
Yeah.
Let me just jump through the rest because I want to wish you good luck. We are almost at the top of the hour, and I still want to give you a chance to ask any question if you want, or share any experience, positive, negative, whatever, some lesson learned, maybe from your study time. Still, some exams end in October, so there is still some time. Some people may have their exam toward the end of the exam period. Anybody, just feel free, unmute, or write if you don't want to speak. It's up to you.
Actually, when you say, so I'm taking it on the 21st of October. If I were to not pass, then I would have to wait until the spring, correct? Because that's pretty much the end of the exam period.
I'm not sure if you can repeat it even if you are in the beginning of the exam period. Pam, do you know if there is such a chance? I don't think it works.
No, I think because you'd have to requalify or, put your paperwork in again. But I think you could, for the next cycle, you would have to wait until then. That's my understanding.
Okay.
Yeah.
Mhm.
It's always like that. Even if you are at the very beginning, you cannot go and say, let me try again.
Okay, more
Yeah,
motivation to pass the first time.
And actually you probably will not get the same test. You may get some of the same questions, but certainly not the same complete test. They usually try to mix those up, or they'll take questions and make a new test, for each cycle. So you're not taking that same test again. Exactly the same.
Imagine there is a question bank of, let's say, 450 questions, then part would be the same, part would be different, and definitely not in the same order, and so on and so forth. It's electronic, it's very easy to organize it electronically, so to replace questions, shuffle answers, and it looks all different.
And they do stuff like statistics and seeing how people are answering questions. And that's how sometimes questions get archived, is, it's not relevant anymore. And some of those, that's why we see them on the practice exam, because they may not be relevant anymore. But that is all put together, very statistically, the test. So.
I had one other question too. I took the test 2 years ago and I flunked by 1 point. Now, is that real? I mean, could it really have been 1 point? Because, as I was like kind of smashing my head on the wall outside of the room and saying, dear God, 1 point. I mean, it's not like scaled or anything, right? It really was 1 point that I failed by.
I'm afraid so, because when I create tests electronically, let's say in Moodle, for example, then each question had certain number of points. You need to reach certain total. You have the maximum possible number of points, and you say, let's say 80 is the threshold. So then it's done by the computer. The computer, if I have like multi-answer question, so each answer gets a proportion of the score for that question.
I see.
One part, and then something is missing. So yes, it can happen.
All right. Well, better luck next time, right? I don't want to say third. I don't want to say third time's a charm. I'm going to say second time's a charm on this.
Well, at least you know what to expect. I think that makes it
exactly.
a little easier. Yeah. That when you do computerized, it's like, do you want your test score? And you're like,
yeah,
do I want
exactly. Right. Yeah.
That's a hard one, because you're like, oh no.
It was tough to swallow, but I'm back at it. So
Yeah, it feels like, okay, you know, I have the loop around my neck and I'm supposed to kick off the table under me. Kind of
Yeah.
feeling.
Yeah.
But okay,
It's taken me 2 years to recover.
you will
crazy.
pass this time.
Yeah.
But
I feel stronger and smarter 2 years later, so I'll give it a try again.
Well, your experience will help greatly.
Absolutely.
Because
Yeah.
you know, we think about, you know, just being a couple of years in auditing, you haven't seen everything. Believe me, I've been, I won't say how many years, and I still come up with new stuff. And I know
Okay.
Camilla and
Oh.
I have talked about this. It's like, I've never come across this before.
Yeah, absolutely. Every day, even as a quality and compliance study lead for clinical trials, every day is something brand spanking new that we've never come across before, and you know, makes not only me and my senior director and my VP say, I don't know about that. Let me think about that. So it's you know, there's so many gray areas, and I think it's just a matter of using common sense. So
Using your analytical mind. The
exactly.
auditors are always doing that. Yeah.
And always
Exactly.
it shows that people can be really creative, sometimes in the wrong area, but they can be very creative in coming to solutions. One tip for everyone who finally passes and is the RQAP, meaning the certified or the registered professional, you can do a lot of things to maintain your registration, attend events, present at webinars. So attend FDA workshops, because always there are some points to gain with that. You can basically get recertified just if you are active.
Okay.
Yep.
Okay. Good to know.
Lots of free seminars and SQA things and lunch and learns and regional, join your regional chapter. We just had a meeting last week, and the FDA was there. Eric Pittman and Audrey, I remember her last name, I'm sorry, gave 2 days of like absolutely spectacular presentations, and right next to them and ask them questions and, you know, have a drink with them at the bar, which is the weirdest thing ever with FDA and, you know, inspectors. But yeah, there's a lot of offerings like that. So you need to keep up, you know, be sure and read the maintenance for your certification too, once you're passed. And
Like going out on a date with the IRS or something, right?
they're so awesome. They really are. You know, they're real people too. So
Right, exactly.
With sense of humor, and it's fun to be with them. And you realize, yeah, they are really people like me, like anyone else. So that's a kind of comforting discovery.
Great. Thank you so much for the guidance. This is great.
sure. And you know, you have our names and things. If you have a question or something specific or something like this doesn't make sense, just, you know, reach out, or even put it on the clinical if you're on one of the specialty boards. That's another great place to have questions answered by a lot of different opinions sometimes, but
Yes.
certainly, you know, if you don't know, you don't know. And so that's a nice place too. Lots
or
of
reach out to my former colleague, Klaus Goodwin.
yeah,
would be
okay, you
very
have
nice,
Klaus's
Tracy.
number. Go ahead and call him.
Yes, exactly.
Yeah, and I would even say, you know, sometimes people feel shy to ask questions and they use the post anonymously. There is nothing wrong that I don't know something.
I'm definitely not a wallflower. I'll come right out and introduce myself, and I'm okay saying that I flunked 2 years ago. It was upsetting, but it is what it is.
It's
And I just
hard.
said I've got
It's
to
a
get a
hard
little bit.
test.
It was a lot more difficult than I expected, but I think again I'm much more prepared this time around.
Hey,
And for everyone who passes, and even for those who don't pass, but consider joining the faculty, because we always welcome volunteers, especially people with recent experience of sitting at the exam. We want to have a big pool of people. It happens that there are sudden meetings at the company scheduled exactly at the time. We are traveling, our schedules are changing. The more people we have, the better chance we have a good panel each time. And it's not just you being bored by me and nobody else sitting around. Having more views and more experience is very valuable.
Okay,
Yes.
thank you.
So
And you get-
again,
Great call.
good luck.
Units get credits for that too.
All right.
Okay,
Thank
great.
you
Well,
very
best
much.
luck to everyone. We'll be crossing our
Yeah.
fingers. Let us know how
All
it
the best.
goes.
Imagine yourself that you have already passed. That's a good
That's
start.
right. That's right.
Visualize.
Put it on my vision board. Yes. Thank you.
Great.
Take care.
Bye-bye.
Bye-bye.
Thank you. Bye-bye.
Thank you.